Good afternoon to all of you. Thank you. I hope you can hear me well. We want to first thank you for being in today's webinar. So let me start. As you already know from previous webinars, I introduce myself. My name is José Jonay Ojeda. I work at the Hospital La Paz in Madrid. I am the leader of the working package 3 of the evaluation group. As you may probably know, we have just started a new grant for all the networks. And well, we have some minor changes. And in this case, Hospital La Paz is the leader of this working package together with the rest of the beneficiaries of the grant. But as you know, this network involves more than 40 centers all around Europe from 21 countries. So as some of them will also see this webinar, let me remind you that my background, I'm a preventive medicine and public health consultant at this hospital. I work in the Sustainable Development Office at the hospital. And well, my fees comes from the Regional Madrid Health Service and the Spanish National Public Health School. And I don't have any other conflict or interest that it should be reported today. As you probably know from other webinars, monitoring is not a new element of the networks. It didn't start at the beginning of the networks, but let me remember you that we had our first monitoring exercise in February 2019. In that moment, we started to collect these indicators twice a year, but finally last year it changed. So we started to collect indicators once in a year. In fact, the last annual monitoring exercise, if you remember, it took place last February, March of 2023, and we collected the full year activities from 2022. And as you also may probably know, the monitoring part of the networks, it's integrated in a wider picture. No, it's linked to the assessment that all of you have undertaken in order to belong to the different networks, and it's also connected to the evaluation. In fact, as you know, the 17 original members of the network were evaluated this year. And they took into account all the work we have done in the monitoring process. And that's also something that is going to be the same for the other full members that joined to 2022 in the near future. And something that I already mentioned at the beginning, we are in a new period of the networks, of the 24 networks. We have just started last October a new grant that is going to last for 4 years. And together with this new grant, the DG Santé has provided us a new version of the ERN monitoring protocol that we are going to discuss today, because it brings us some new changes, some important changes that you have to know as members of the networks, and that we are still in progress. We don't have yet a full picture of what is going to happen for our network, but we can for sure discuss it today. And I hope you can also give us some feedback, so we make it as simple as possible for this new stage we are getting on with this new grant. As you probably know, we started the networks in March 2017. In that moment, we have an initial assessment. And later on 2019, the DG Santé opened a new call. And from that new call, we had a new affiliated partners and new full members that started officially in 2022. As I mentioned before, from February 2019, we started the monitoring exercises. We have recently, as I mentioned, have the final results of the evaluation process. And due to this evaluation process, the DG Santé has shared with all the networks that some of the ERN members has terminated the relationship to the networks. It's not the case of our network, because as I mentioned before, all the 17 members that had gone through the evaluation went through, but I want to remind that this is one of the requisites that the European Union takes into account when deciding that we keep on inside working with the networks or not. And that's also a very an important issue that we have to remind today. Just to give you an overall view over here. I don't see the slide over here. Yes. Just to remind you, we talked about this in the last webinar when we launched a previous year monitoring exercise. There is an overall setting for this monitoring process. That is the assessment, monitoring, and evaluation quality improvement system that is set up for the 424 ERNs. And in this case, you can see that we get information from not only the ERN coordinators, but also the healthcare providers. I tell you in advance that this is going to be a big change for this year monitoring exercise that I will explain later on. But also this assessment, monitoring, and evaluation quality improvement system also is expected to get information about the functioning of the networks from the member states and the patient representatives. In fact, in the evaluation process, there was some interviews with patient representatives that were taken into account when producing the final reports. In this case, as I mentioned, there has been produced a new ERN indicator document that it was presented in the working group of the networks last September. This new ERN indicator document has included new indicators that are in line, that are aligned to the new grants, and that is something that we are going to see in more detail following. So I have to say that this is not the final document. In fact, they have announced us that there will be some webinars open also for the ERNs members in this month of December, and we expect to get the final document by this month of December. But we have a pretty fair idea of what is going to happen next year. So the first change that is going to happen for the next data collection that is going to take place next year is that there's going to be 2 stages. The first one, and that is a big change for all the networks, is that you will have to answer to this monitoring exercise for the first time. From previous exercises, what we did was we launched an annual monitoring survey in order to collect the data from you, and we as coordinating center put this data in this monitoring exercise. But that is going to change for this following year. In fact, it is planned that next January and February, it will be open for every healthcare provider to post specific indicators that we will see this slide later on. And this is, as I said, something new that we have to be prepared on. So this is one of the goals of this webinar, in order to let you know that this is going to happen. In order to do so, DigiSante had also told us that they will require every hospital, every healthcare provider to appoint a contact person per ERN membership. Okay, most of you or some of you belong to more than one network, and at the hospital management level, they will decide whether there will be a person fulfilling all these questionnaires, or there will be a separate person per ERN membership. Okay, so that is something that you will decide at HCP level. Okay, what it will happen is that the DSNT will ask for 2 of those indicators directly by you. You will have to fill this information from your records. One of the indicators that they will ask directly to the HCPs is the new patients referred to the HCP. This, as you may remind from previous monitoring exercise, this is a key indicator for the networks and for the DG-SANTE. And we will see in the following slides, we will refresh what is expected for us, for a network that is related to transplantation programs, what is expected for us to put this, in this case here. And also for the first time, they will ask information about the use of ORFA codes at hospital center, at hospital level. So in this case, what they are going to ask from you is whether you use ORFA codes in the patients that are related to the topic of every ERN. So in our case, they will ask for the use of ORFA codes in the transplantation process, programs you have in your centers. Just to remind you, this is, as we mentioned in the previous webinar of the monitoring exercise, the total number of new patients referred to the HCP, it's a key indicator for all the networks. We have to remind you that what they want us to collect are the new patients that have been attended or been referred to our transplantation programs within the specified time frame. In this case, it's going to be the full year 2023, and having a certified diagnosis of rare disease. Of course, we have discussed in the board of the network and previous meetings that in our network, we want to get this information not only in relation to the patients that may go into the transplantation procedure, but also to those patients that, although they have not been transplanted in our centers, they may have been or they are being followed up in the outpatient clinics, or even, as we discussed in the last board of the network in Warsaw, we are also asking you to obtain some information of those patients that you attend in the transplantation programs and you evaluate pre-transplant. That's something that we considered that we should have that overall picture in order to have an accurate data of the new patients that are being attended in our network. Of course, they don't include patients that, I mean, it doesn't apply to our network, but it's applied to other networks. A patient that doesn't have a diagnosis should not be taken into account. And of course, if we attend a patient twice, it should only be counted once. Of course, as I mentioned, and you already know from other activities from this working group, as I mentioned, we want to focus not only in the patients that may attend transplantation process, but also those that during the year may have had some evaluations per transplant, but didn't go transplantation, or those that may have get to the hospital only for transplantation follow-up. So that's something that we have been improving in the last monitoring exercises we have done in the network, but we have to keep the focus on this following year too. As I mentioned, you can stop me anytime, and we will have some time for questions at the end of the webinar. So let me talk to you about the second stage of the monitoring exercise that the DG-SANTE is going to launch in the following weeks. The stage 2 is going to be, as previously, the moment where the ERN Coordinated Center will report all the other indicators that are included in that document I presented you before. Of course, there's the possibility that you as healthcare provider will fill up data, and later on there can be some changes to those data. Okay, we will have the chance. I mean, you will have the form closed at HCP level, but at ERN coordinator level, we will have the chance to check those data, and we can just change the data in case you detect that is not correct, the data you have provided us, or just have had any problems in order to fill up the form in the previous stage. And at the same time, we will keep on filling up other data at ERN level. As you know from previous monitoring exercises, that this is one data that we do not ask you, but we will put the information of the activity of the CPMS platform that will be included in the monitoring exercise. We will also put information on the education and training activities that we have registered at coordination level. But as you know, we also ask that information from you. The new thing for the next year is that they will also ask for the trainees, the number of trainees included in those education and training activities, whether it is those that acquire higher education credits or those that doesn't. Of course, they will ask also from us, from the coordination level, to put inside the monitoring exercise the number of studies, even clinical trials of observational prospective studies that we have achieved as a network, the accepted peer-reviewed publication that we have done, and that's something that's new. For the first time, they will also get information about the patients we upload into the ERN registry. Remember that in our case, it's the Peter registry that is open for all the centers to get into. And as I mentioned, this is going to be the first year that this data is going to get into this monitoring exercise. Again, some data that we will also provide as the coordinating center is the development of clinical practice guidelines or other clinical decision-making tools. And again, as the previous years, congresses, conferences, meetings where we have presented the results of the network, the website hits, the number of people who visit our website. And for the first time, they will also ask for information from the documents we put in our website, and it's done the number of downloads of these documents, the number of webinars and attendees, for example, this webinar, and the attendees from this webinar is going to be data that is going to be collected by us at the coordination level, but it's going to be provided to this monitoring exercise for the first time. Again, something that is new this year. As I mentioned, this is the information that we are going to put from the coordination level. We will have the chance to check the information that you have provided in the stage before. And again, what we have to discuss now is that as other networks, as other ERNs, we have some specific indicators that we have been working together in this working group, in this working package for the last year. In fact, we also get information from you about the type of transplantation programs, the number of transplantations performed. We discussed this in VASO. We are planning to get also information about your specific milestones from your program transplantations, like, for example, the first leaf donor transplantation or other milestones that are deemed interest for your specific transplantation program. Again, other activity that we plan to collect is the mean hospital stay for transplanted patients, the number of visits in a patient setting, the number of patients, or even attended in that outpatient setting, and also in general the number of patients that you have active in the program, whether they are in the follow-up process or they're in pre-transplantation or they have been transplanted that year. We are planning to get over the following years indicators about readmissions and other complications rate. And you know that we have also been collecting data about your survival results, whether it is solid organ transplant or hematopoietic stem cell transplant. Of course, we discussed this in VASO. We will not ask for survival indicators for those HCP with only follow-up activity. In the previous survey we did last year, this form was open to those programs, but this year we will try not to ask to put this specific field in the form, so it will be easier for you. We also have been collecting other information about the exchange programs we have about pediatric transplantation, the participation in transplant-related research consortiums, or even the use of certain quality certifications or accreditations related to transplantation. Of course, as you know, we have a specific working package about the involvement of patients in our networks, and we want to also to get some information about the activities that are carried for the patients, or any specific material we have prepared, that we have been working on that in the network, and that is something that we also plan to have in our network. As you can see in the slide, we have no specific date for the launch of our survey. As I mentioned, we are waiting for the DG to launch the specific monitoring exercise for HCPs and the coordinated centers, but it will have the same appearance as the previous one. In fact, what we plan to do, we don't know, as I mentioned before, the date, is to collect through this survey all the information that you may have at local level that we could use at coordination level. So, for example, we will ask from you in this survey about the full year transplantation activity. We will ask you again about the new patients, including transplantation programs. So the idea is that we can check the information you have put in the DG monitoring exercise platform. We will also ask about the total number of patients active in your programs, the survival results, and the other additional activities that will help us to fill those fields, as I mentioned before, for example, the use of offer codes, the education and training activities, the clinical trials or observational prospective studies, the publications, the guidelines, conferences, congresses and meetings, etc. Of course, as we mentioned also in the last board of the network, also this time in our survey, we will not ask for a full list of additional activities, but we will like you to select those that you may have done during this 2023 that will be acknowledged by TransplantChild and that we can add to the overall activities of the network. As I mentioned before, we have no date, but to let you know, last year we have no date for our survey. As I mentioned, there's a date for the ERN monitoring exercise from the DG. But to remind you, last year when we launched the survey, we did the webinar in January, and the survey, the TransplantChild survey, was open until the 17th of March. We expect to have the specific TransplantChild survey open in similar dates as last year, but as we don't know yet when it's going to be launched, the DG monitoring exercise, we are waiting for that. But as soon as we know the dates, we will provide you with this information, and we will, as you can see in the slide, try to make this monitoring process as simple as possible, with the difficulty that, as we have been telling you, that this is for the first time an exercise that at the DG level you will have also to fill. Of course, there's something that it was also registered in previous exercises, but if you don't fill the form on time, as I mentioned, the ERN monitoring exercise in time, the result will be automatically submitted and recorded as blank at the end of stage 1. In this monitoring working group, where we gather all the networks, they told us that there is no decision yet regarding the consequences of non-submission, but what they are planning to do is to get that information into the evaluation process that is expected to happen by 2027. Of course, as in previous monitoring exercises, we are planning to do internal validation by TransplantChild, because we have been gathering information from all of you from the previous years, but we will discuss also the data that we are going to gather, not only in the board of the network meetings, as we have done before, but also in the evaluation working package of the new grant. As a summary, and we are about to start the sixth annual survey of our network. As we have been telling you, with the launch of the new grants for 2023-2027, there's some new key performance indicators that have been added. Those indicators are also included in the following, or in the objectives of the grants. So what they are planning to do is that we take that information not only for the monitoring of the network, but also in order to see how we achieve the task included in the grants. And as you can see, again, the biggest challenge is going to be that you will have to fill up these monitoring exercises for the first time from your centers. The expected date in order to put up this data from every healthcare provider is going to be February 29th on 2024. And of course, we are planning, as we did in several years, and also all the networks are planning to do still their own surveys, because we have, as you have seen before, some data that we have to record at coordination level, and also at the specific process that we are taking into every network. We are planning to do this survey in similar dates as the previous year. And of course, we will try to take this data that you may give us in the survey to correct and to check the data that you may have provide to the DG in the stage 1. Just let me remind you that ERN membership implies participation in the annual monitoring exercise. And we are planning to keep working with the operation areas to provide support to all the centers. As you know, what we did last year is that through the operational areas, you had support in order to follow up the completion of this survey. We are planning to do the same. We have a meeting of the steering committee of the network next week in order to discuss that with them. And just a final message again. We kindly ask you to identify which is going to be the contact person per ERN membership who will be giving access to the online platform. As I mentioned before, we won't be able to access the platform at local level because it's going to be done by you. Of course, as previously, you know that they are going to ask you about new patients and the use of ORFA codes, as I mentioned before. So please prepare in advance and try to gather that information from your local teams. And of course, if you report the data, please have adequate evidence in order to support them. We are planning to do the same annual monitoring exercise that we did in TransplantChild to collect from you the additional activity that we need to fill our part of the survey. We have no date yet, but we hope to have that date as soon as possible. We wanted to make it as simple as possible, so we are going to communicate that to you as soon as possible. And of course, as I was telling before, we have to keep in mind that reporting what we do, of course, is very important from the quality improvement point of view, but also a very important milestone for the networks and the future evaluation process that is going to take place during these following years. If we don't fulfill this requirement, that may lead to termination of ERN membership. That's all.